Did you know that complex PTSD starts out really impacting the brain? Most people are knowledgeable about post-traumatic stress disorder, but when it comes to PTSD that's complex, right? So complex PTSD, things get a little bit complicated. One of the reasons for why they get complicated is because, firstly, complex PTSD is not a diagnosis in the Diagnostic and Statistical Manual that we clinicians use to diagnose. The only thing that is in the DSM right now is PTSD, post-traumatic stress disorder. But there are some studies that are trying to, get complex PTSD down in the DSM, written down as a clinical syndrome, and treated properly. Complex PTSD is something that can happen for a variety of reasons, and right here in this video is where I just discussed that issue, so check this out at the end of this video. But in today's video, I want to talk about what's going on in your brain, because you do, if you have complex PTSD, you do show a lot of symptoms of changes in brain volume. You show a lot of cortisol levels that have gone up. You also show fight or flight responses physiologically when you shouldn't at all. And then the reason for this entire video we're going to get to, which is how to overcome the master manipulator if you have one within your family. Let me introduce myself in case you're new to this channel. My name is Tamara. I'm internationally and I'm board certified in trauma therapy. I'm licensed in mental health. I specialize in treating children, teens, and families, even adults, right in my private practice. Let's jump in. Complex post-traumatic stress disorder that isn't properly treated or identified and treated can cause a host of issues for you as you move along in your life. Untreated or poorly treated complex PTSD can result in a lot of other mental health conditions that are difficult to extinguish or to get rid of. And an example of this would be what is called a co-occurring psychological disorder, which means you may have complex PTSD, but you also have a substance abuse or drug abuse issue. So both of those things go together. There may also be what we call a comorbidity, meaning that you have complex PTSD, but then you also have major depression, anxiety, social phobia, OCD. Maybe you have borderline personality disorder along with complex PTSD. When complex PTSD isn't identified and diagnosed properly, then other conditions come about, which kind of compounds the issue. And so instead of just having complex PTSD, you now have complex PTSD and maybe a marijuana abuse, or there's marijuana usage that's way over the limit that's appropriate. Or you may have a alcohol issue where you're drinking a lot of alcohol every day, all throughout the week, but you're also suffering from complex PTSD. So when those things kind of collide, you're going to see a variety of changes, not only in yourself, but in how you process the world and how you function within it. You may also have anger management difficulties and chronic pain. There's also, according to research, a lower life expectancy for individuals who have complex PTSD, but they're also dealing with untreated complex PTSD or poorly treated. And let me also mention that there's a higher percentage of suicide attempts and suicidal ideation, I should say, or thoughts when you have untreated or poorly treated complex PTSD. The numbers go up. Suicide is the second leading cause of death for adolescents, but it's the 10th leading cause of death for adults. So there's a lot that goes into that. And one of the reasons why it's the 10th leading cause of death in the United States is because sometimes there's complex PTSD or PTSD that's a part of the picture, but it isn't identified and it isn't treated. When you have complex PTSD and it's not treated, or it's poorly treated, or you don't quite recognize what triggers it, it's important to understand what's going on in your brain. Now, when you have complex PTSD, your brain is constantly on overdrive. It's like an engine, and that engine is just going and going and going, and there should not be that kind of response to the environment, but it is. And that's because your brain perceives danger and threats. When your brain is on overdrive, executive functioning decreases. It may be a little bit difficult for you to think, to remember things, to make decisions, to process cognitively what's going on in your world. And you may also struggle with remembering things that you should know, like your birth date or your home address, or maybe even details that happened yesterday. And that's because, again, complex PTSD may be poorly treated or untreated in your case, and increased levels of cortisol, which is a stress hormone. Here's the definition right here on the screen. And decreased executive functioning, which means there's a reduction of functionality right here in the prefrontal cortex, which is behind the forehead. And the prefrontal cortex is an area where personality originates, impulse control, decision making, higher order thinking, right? Rationalizing, being logical, and really functioning cognitively every moment in your life and every day. When that decreases because of untreated complex PTSD or poorly treated CPTSD, it's going to be difficult for you to function. Now, let me also mention too that not only is there an increase in cortisol levels, but there's also an increase in amygdala activity. So let me explain. Right here on the screen is the amygdala, and it's an almond-sized structure in the middle of the brain. And that part of the brain I talk about all the time because it's very relevant to how you respond to triggers if you have PTSD or CPTSD. The amygdala, this almond-sized structure, really does do a lot for us. And one of the main functions of the amygdala is for it to grab onto emotional memories and store them, right? So an example of this would be, let's say you went to Disneyland for the first time with your little boy and your mom and your grandma and maybe some extended family. You guys had a wonderful time and you laughed and you just spent the night in each other's hotel rooms and you just had a wonderful, wonderful time. There were family photos, the list goes on. Your amygdala is functioning at that moment and it's pulling from that emotional experience and committing it to your memory. And the hippocampus really does a really good job of cementing that memory. Now, the hippocampus is connected to the amygdala, and it's another part of the brain that functions to help cement those emotional memories. It gives you context. Okay, so the amygdala is emotional, and the hippocampus sometimes works in a way that really helps the amygdala by cementing, for example, those emotional memories that you have. It provides the context, where you were and what happened, etc. So when you have these two things working, you're going to remember those emotional pieces of that trip. Well, let's think of this in terms of a negative way, meaning, let's say you were sexually abused and then you were beat and then you were harmed for the rest of your childhood up until you turned 16 and you ran away. Your amygdala has pulled some emotional memories from that experience and has committed them to your memory, and the hippocampus comes right behind the amygdala and stamps it and says, yep, that's what happened. And so as you move along, the amygdala may get triggered by high levels of cortisol and threats in the environment, because the amygdala is like a flashlight. It's constantly searching for something that could be threatening to you. So what causes this in a family when you have a master manipulator? Well, if your father was a master manipulator and he's a psychopath, or your mother's a master manipulator because she's a narcissist, or she has borderline personality disorder and bipolar disorder, which makes her emotional, and it kind of contributes to her rage and her anger, right, and her irritability. If this goes on for a long period of time and it is unchanged, and you have experienced a multiplicity of experiences of trauma, then you can continue to suffer with complex PTSD. Keep in mind that master manipulators are just not manipulators. They're pathological liars most of the time. They are skilled at cheating people, skilled at lying, and really getting people to emotionally believe them and latch on to them, right? That's why they're so dangerous. This is almost like a career. They are skilled at this, right? If you have a manipulator in your family, how do you deal with that? Well, let's look at that, okay? And the only way that you're going to heal from PTSD or complex PTSD is to figure out how to maneuver in a very unhealthy and dysfunctional family dynamic, right? Because you have to get over here away from your family in order to heal. If you're stuck right in the middle of that dysfunction trying to heal CPTSD or PTSD, you're not going to get anywhere. So you're going to have to go over here and figure out what you need to do before you can manage that situation properly. So let's look at this together. The first thing that I suggest to my clients when they are dealing with dysfunctional family members or master manipulators is to think about and process your basic human rights. I know that sounds so simple, to think about and process your basic human rights, but it really isn't that simple, right? When you're struggling with post-traumatic stress disorder or CPTSD, you may find that it's very, very difficult for you to step out of that situation and recognize that you're worth more than what you're being treated like, right? So step out of the process and really, really double down on your basic human rights. I deserve to be respected. I deserve to be treated with respect, with love, with compassion. Develop self-compassion. Now, here's the definition right here on the screen of self-compassion. The one thing that you want to do, in addition to the last tip that I gave you, is really identify ways to be compassionate to yourself. Because when you aren't compassionate to yourself, right, then you end up making decisions that could be ultimately harmful. Think about how compassionate you are when someone is homeless and you see them on the side of the road. You just want to give them money. You want to give them food. Your PTSD and complex PTSD is so intense, right? You have flashbacks, irritability, depression, increased suicidal thoughts, right? Maybe you've attempted suicide before. Maybe there's some anger and rage under there. You're going through a lot, right? You need self-compassion. Learn about burnout and compassion fatigue. When you're dealing with a master manipulator or somebody who's a liar within your family, you really need to learn your own signals. When is my heart and my mind and my brain telling me that I'm overloaded? Learn about burnout and learn about compassion fatigue. Try not to ask for multiple pieces of information and advice from everybody in your world. If you go to someone because you need support to deal with the master manipulator, that's totally fine. But if you're going to Aunt Susu, going to Grandma Mimi, going to your husband, going to his best friend, then going to your best friend, right? And maybe even talking to your coworkers, and you have this boatload of information to try to weed through to figure out the master manipulator, don't do that. Because here's what's going to happen. You're going to sink beneath all of that information that you've gotten, and you're going to be conflicted. You're not going to know what to believe. Sometimes you can get advice from multiple people, and it's right advice, but the issue is, does it apply to your specific situation? And if the answer is no, don't go there. Strive to shape the master manipulator's behavior. You can shape behavior. Shaping behavior can happen with a negative and positive reinforcement. So here's what I mean. I'm a child and family therapist, but I also see adults who are dealing with, some trauma, PTSD, CPTSD. Everything I talk about on this channel is applicable to my adult clients. And one of the things that I strive to do with them is to shape their behavior. And I do this with praise, identifying strengths and weaknesses, really celebrating their moments of success, treating them a certain way at certain times so that they will get used to how I treat them and they will change, right? And you can shape the master manipulator. Don't respond to the master manipulator. You shape their behavior by not responding. When you do something so many times over and over and over, it shapes the behavior of that other person, and that's the best tool that you can ever get. Recognize that master manipulators within your family can have great communication skills. Master manipulators are not dumb people. Again, master manipulators are skilled at manipulating. They are skilled at using English and language, and some even know foreign languages, and they throw that at you as a way to kind of, make you feel special and, come across as educated, or to go way over your head. Come goal-oriented. You have to keep in the forefront of your mind your ultimate goal. If you try to communicate with a master manipulator, and you don't know what your ultimate goal is for that communication, then you're going to get lost, right? And what you want is a firm foundation to stand on, and the only way to do that is to be goal-oriented. If you want to learn a little bit more about this topic, go go ahead and click right here so that you can see my most recent video on complex PTSD, and click right here for a video on, I'm going to say compassion fatigue, because it kind of talks to you about compassion fatigue for professionals, but you can kind of get an idea of what this looks like in yourself. Thank you so much for being with me in today's video, guys. Go ahead, hit that subscribe button and that bell button if you want to stick around with me, and I'll see you guys next time. Bye-bye.